So hello to all the viewers, and with me I have Dr. Praveen, who has secured rank 62, national rank of 62 in the NEET SS medical group entrance exam. Dr. Praveen, awesome achievement in such a competitive exam. Hearty congratulations.
Thanks a lot, sir.
All right. So results, how does it feel right now?
Happy, sir. That's it. One word.
Okay. All right.
Now the track is finalized. We need to go further.
Okay, got it. So, Praveen, the viewers would like to know more about yourself. So,
Okay.
where did you do your MBBS and MD from?
Okay, sir. I am basically from Pondicherry. I did my MBBS and MD from Qbank.
Okay.
So I finished my MD in last August, and I worked as a senior resident in a private college near my house.
Okay.
And I'm preparing for this NEET SS for the last 3 to 4 months. I have resigned and I'm preparing solely for the NEET SS.
Okay. Because I still remember you sending me a message once the DocTutorials announced the quick revision program. You sent me a message also about the QRP and when is it going to start. And we'll start off with that. Praveen, how useful were the DocTutorials quick revision program sessions?
Sir, initially I started preparing subject wise. I made notes for all subjects, and as like everyone used to like their focus will be on NESS as well as NEET SS. So we need to go much into the subjects with respect to the NESS, and NEET SS being a common medicine paper, so we'll have to touch in all systems. So we'll have to have a good knowledge in all systems. So I was going through that in initial 3-4 months, 3.5 months. Then towards the end, last 1 month, actually, I was texting you as soon as the session was announced. So in fact, it was around 20 days prior to the onset of session. So towards the last 1 month, I had been focusing more on the QRP sessions because like to revise everything, whatever we have taken, it's a bit it's difficult. So I started my revision schedule, everything based on the QRP program. So it was helping me. So I went through the videos, went through the tests, then like it guided me towards the last 1 month of my preparation, which molded my preparation.
All right. So this is very important because again, to all the future aspirants as well, medicine is a vast subject. So it's important as Praveen has said, we have to prepare notes. But towards the fag end of your preparation, it's very important to revise properly, consolidate properly, give the exams so that you are able to retain the information, because it's not humanly possible to be thorough in everything, every topic of medicine. So you have to cover, however, the most high yield topics, everything you have got to be very thorough at. And that is what Praveen actually did. And Praveen, what is your score and approximate number of correct answers?
Sir, 120. So the score was 450. So probably 120 correct.
Okay.
So I expected around 120 to 120. So
how many did you attempt?
I attempted everything.
Everything.
Like, everything I attempted.
Okay. So this again is a message for the future aspirants, because I took interview of many of the toppers, rank 1, 3. So rank 1, rank 3, they attempted all 150 questions. So many of the toppers, even in the top 10, the others also, majority attempted above 145. So many of the candidates usually ask me, how much should we target? So if you're targeting a top rank, yes, you have to be a bit aggressive, which is again important. Okay. So Praveen, coming to the preparation phase of yours, you've done your MD from Qbank. So how crucial was Harrison for your preparation?
Sir, to be frank, in my PG days, I didn't read much. Like the duty was slightly hectic, okay. So I didn't read much. So I was focusing more on the practical things, and in fact, I was not focused much on the specialty initially during my MD days. Okay. So I want to make my basic core stuffs strong. Okay. So after that, then I was thinking I was not very sure of the specialties as well. So I needed some time to think over the specialties. So I joined outside as a senior resident, and I was talking to many people, and then I retrospectively analyzed my areas of interest. So then by Jan Feb, I made a plan that I should go out for a full preparation.
Okay.
Then I started with this lectures and Harrison. Harrison, as in I couldn't finish everything, meaning that no one can finish the text in between. No one can go through it word by word. More than reading, we need to retain. See, Harrison, actually, we are reading from UG days, so, but still, every time when you read it, like you will forget things. So I wanted to make it very simple, sir. I focused on the important, in fact, all tables and all treatment algorithms, and this is how then images and everything I went through it. So this is how my approach was to Harrison. And whenever I did questions from question banks, I went through Harrison. So my way of reading Harrison towards the last thing was retrospective, not like the usual way. So I did questions, I went back and went through the text and tables.
Okay. So even in the DocTutorials video lectures, as well as the quick revision programs, we actually highlighted the recent changes in the 21st edition Harrison as well, like the newer drugs, the newer trials, everything was highlighted. And coming to the paper of the medical group, Praveen, you would agree that it was always a cloud of uncertainty leading to the exam. So how did you manage yourself? How was the mental pressure? How did you handle that? Because many candidates ask this question. Okay, though it might appear as a general question, but many candidates actually message me. It's often the pressure of what to expect and what to learn. So, as a topper, as someone who has cracked this exam with very good rank, how did you actually keep your composure during the preparation phase?
So during preparation, I didn't focus much on this pattern and also because whatever it is, they're going to ask on the basic subjects. So if there is asthma, they're going to ask on the recent updates and guidelines, so there is no point in worrying about the pattern because we ourselves don't know like what will be the pattern. So moreover, even if the pattern was medicine, so the question paper also was too much not at all predictable. So I did I focused on all aspects, as in like factual as well as conceptual. But mostly it was a conceptual preparation. So because I expected a conceptual paper similar to the last NEET SS, the management and all those things. At this time it was more of a factual paper.
Factual. Correct.
So the way I prepared probably it helped. So
All right.
And moreover, it was like a NEET PG, as everyone told. It was like a NEET PG paper.
Correct.
And
as said by many of the toppers, also it was similar to a NEET PG paper. Okay.
And during my preparation also, I focused on the NEET PG questions. So I actually solved the last 3-4 years NEET PG and AIMS question papers. And because I need to make my basics strong, so that I need to upgrade further to the specialty knowledge.
Okay.
So and moreover, it is a general medicine paper, so we cannot expect them to ask more into the subject. And so okay, it was a fair mixed preparation with factual, conceptual.
Okay. All right. And at the end of the exam, were you expecting a rank in 62 or even better?
No, sir, I didn't expect anything. I gave the exam, I didn't check even.
Okay. You did not even check you done the recall sessions, you did not bother even to look at that, right?
No. I need to keep myself calm. So
okay. All right. So
I expected around 125, sir. 125. So because by the way we attended, so I expected around 125. Okay, fine. Probably I should have got around 120.
Okay. All right. So how important were the grand test? Writing the grand test.
So actually, as soon as I prepared and finished taking notes of one subject, I did grand test. This I did from the beginning. So this was my approach. So
how were your ranks in the grand test? How were your ranks?
Actually, towards the last only, I saw the ranks of mock exams. Okay. So I don't have the habit of checking ranks from the NEET UG days. So I will give the exam. I will see the questions and the solution, and I'll go through the areas which I am weak and the areas which I guessed. So
Okay.
this was my preparation, because ranks are relative. So I don't believe in this ranks.
Now that is a different answer. In fact, it's a different style, because see, but again, that has worked for you, because the most important thing is it's not just about the ranks. You've got to see like what are the mistakes that I made, how many mistakes were silly mistakes, and are there areas which I have not touched upon and I should go back and read again. So that definitely is a good strategy. And Praveen, from now, which branch are you going to take?
Sir, planning to take medical gastro, sir.
Medical gastro. Okay, so it's definitely an exciting branch. And Praveen, all the best, because this is such a big achievement, having secured this rank of 62 at the national level. And all the best. I hope everyone in the family is overjoyed with your tremendous success, and all the best. Okay, thank you so much for